Do you have hip pain? Have you been told that you have hip bursitis? Does your hip hurt right here, right on the side of your thigh, side of your hip? Does the pain increase with laying on that side or with laying on the other side with one leg crossed over the other? Does it hurt with walking, especially up and down inclines and declines, or with shifting your weight onto the hurt side and standing like this? If you have these symptoms, you've probably been diagnosed with hip bursitis, and this video is for you. Hip bursitis, often called trochanteric bursitis, is really not, or at least mostly not, bursitis, but rather a problem with two specific tendons. The tendons of the gluteus medius and gluteus minimus muscles where they attach on the thigh bone. Over time, these tendons can wear out if some repetitive force is transmitted through the tendon. This might occur with walking long distances if you're not used to it, on vacation, something like that. Or with starting a new workout program or job where you're just not used to the physical demands. Sometimes these tendons just break down over time. The key to treatment is twofold. Number one, avoiding movements that compress the tendon into the thigh bone. Things like crossing the legs when you're sitting, for example, or trying to stretch your IT band. The other key is strengthening the gluteal muscles. The strengthening exercises actually stimulate a healing response in the tendon itself, and the added strength improves control of the pelvis, which decreases that compression when you're active. This program is about strengthening these specific hip muscles. Our first exercise is isometric hip abduction. So in this example, my left hip is the hurt side. So hip abduction is simply lifting the hip straight to my left. Okay, now we're going to hold this for 10 seconds. That's the isometric part, the hold time. And it's that hold time that seems to be instrumental in stimulating the healing response that I mentioned in the intro within those tendons. So hold for 10 seconds, come back to the starting point. Repeat. We'll do 10 repetitions. You don't have to lift real far to the side. It would be super hard if you try to do that. We just want time under tension in that tendon. That's really the key component. The other component is repetition. So this will be 10-second hold each rep, 10 repetitions, but 4 times per day. And it's that repetition per day that, again, is instrumental in creating that healing response within the tendon itself. This exercise is a banded squat. The point of the rubber band is the force of the band is pulling my knee inward. Those hip muscles I mentioned are having to push out against that force. You're trying to keep your knees generally lined up with your feet. Don't let the knees buckle inward, okay? So all you're going to do is squat down to the chair. If you can't quite make it to the chair, fine, do what you can. Squat to the chair, hold for just a moment, up and down, 10 to 15 times. So this is really working the side and back hip muscles. Before the next exercise, I want to remind everybody, if this content is helpful for you, click those like and subscribe buttons, leave a comment. So the next exercise, we're going to use this rubber band. We're going to put it around the hurt side knee, my left knee. Now at home, I've got the band tied to my bench. You can simply close the band in a door. That'll work. The point is, we have some force pulling the knee inward, and you have to resist that. You're trying to keep the knee approximately lined up with the toes. So all you're going to do is step back, lunge down a bit, all the while keeping my knee and foot lined up, come back. So what's happening is this force, this pulling force, is making those hip muscles work a bit more than just a straight lunge. So resist that. Don't let that happen. Okay? Back and forth, 10 to 15 times. Our last exercise is a banded bridge. The point of the band, again, is to force those side hip muscles to really engage. The band wants to pull the knees inward. You're maintaining some force outward. So basically keeping the feet and hips lined up, not letting the knees buckle inward. So with the band around the knees, simply lay back, feet and knees at approximately hip width, maintain that position, lift up, hold for a count of 5, come down. And again, it's that hold time, that time under tension within that tendon that seems to help stimulate this healing response. We'll do 10 repetitions of this exercise. That's my hip bursitis, really again, slash gluteal tendinopathy home exercise program for hip muscle strengthening. I hope you found this program helpful. I hope it helps you get back to what you love to do. Like and subscribe, leave a comment, and we'll see you in the next video.